if you are over 60, I need you to pause for a moment. That D3 plus K2 combination pill, the one everyone from wellness blogs to doctor's offices praises as the perfect pair for your bones and heart, you may be unknowingly harming your kidneys. It sounds surprising, I know, but a growing number of seniors are reporting unexplained kidney issues. They start with subtle signs, a little more fatigue than usual, a persistent dry mouth, or waking up more often at night to urinate. Most people just blame aging, but the real reason might be right there in that daily capsule. I'm Dr. William Lee, a physician with over 25 years of experience specializing in age-related muscle loss and senior nutrition therapy. I've seen this pattern, and we need to talk about it. In the next 30 minutes, I am going to show you exactly how this happens. We'll look at how this helpful interaction can turn harmful, see the real medical cases, and learn the clear practical steps to protect yourself. If you or someone you love is currently taking this supplement, this is critical information. Before we begin, please let me know in the comments what state or country you are watching from. All right, let's get into our first section. Section number 1, the mechanism of harm. Why is balance so important? To understand why a supplement that is praised so highly can become a hidden risk, we need to look closely. We have to understand how these vitamins, vitamin D3 and vitamin K2, actually work inside your body. The story is not as simple as D is for bones. The truth is far more complex, and it revolves around a delicate balance. And the master regulator of this balance is not your bones. It's your kidneys. This is the first and most critical piece of information that is often missed. Most of us think of our kidneys as simple filters, like a pool filter, just cleaning the blood of waste products, which they do. But for vitamin D, its role is far more active. They are not a passive filter. They are the activation factory. Here is what happens. When you take a vitamin D3 supplement, or when your skin makes it from sunlight, it doesn't immediately become active. It can't do anything just yet. The first step happens in your liver. Your liver converts it into a storage form, a molecule called 25-hydroxyvitamin D. This is the version your doctor tests for in your blood. It's the storage tank level, but this storage form is still not the active form. The final critical step happens in your kidneys. Your kidneys take that stored vitamin D and they convert it into its final active form. The powerful hormone called 125-dihydroxyvitamin D. That is the version your body actually uses to manage calcium. So, in simple terms, your skin or your pill starts the process, your liver prepares it, and your kidneys. Your kidneys finish the job. This means your kidneys are active participants. Every single day, they are making decisions. They help determine how much calcium gets absorbed from your food, how much stays in the blood, and how much is sent out of your body. This is why vitamin D metabolism is so tightly, so intricately connected to your kidney health. Now, let's talk about vitamin D3's main role. As I said, its primary job is to promote calcium absorption in your intestines. Think of vitamin D3 as the faucet. When you take D3, you are turning that faucet on. You are telling your body to pull calcium from your food and move it into your bloodstream. When levels are normal, this is essential. We need it for our muscles, our nerves, and our bones. But what happens when that faucet is turned on too high? This is the problem with many high-dose supplements. People think that if 2,000 international units, or IU, is good, then 5,000 or 10,000 must be better. But it's not. When your vitamin D3 levels rise too high, that balance breaks down. You start absorbing more calcium than your body can safely use. Instead of helping your bones, that excess calcium is now circulating, flooding your bloodstream, looking for a place to go. And this is where it often ends up, where it doesn't belong. This is precisely where vitamin K2 was supposed to help. If vitamin D3 is the faucet, vitamin K2 is the traffic cop. It's the director. Vitamin K2's job is to manage all that calcium that D3 brought into the blood. It does this by activating specific proteins. Two of the most important are called osteocalcin and matrix GLA protein. Osteocalcin is like a magnet. It helps pull the calcium into your bones and teeth where you want it. Matrix GLA protein, on the other hand, is like a shield. It keeps calcium out of your soft tissues, specifically your arteries and your kidneys. Without enough K2, that calcium just can't find its proper home. It may settle in your blood vessels, leading to hardening of the arteries. It can settle in your joints, or it can settle inside your kidneys. So, the combination pill sounds perfect on paper. The D3 brings in the calcium, and the K2 directs it. And when it works beautifully. But here is the deadly imbalance I mentioned. If the ratio between them is wrong, or if your body's metabolism slows down with age, that fine balance can easily tilt. Imagine this. You take a high-dose pill with 5,000 units of D3, but only a tiny, insufficient amount of K2. The D3, that powerful faucet, is now pushing calcium into your bloodstream faster, much faster than your K2 traffic cop can possibly manage it. If you're already a bit deficient in K2, or if your liver isn't working perfectly, that extra calcium has nowhere to go. It starts to form deposits, tiny microscopic crystals. And your kidneys, the very organs that activated the vitamin D in the first place, are now forced to try and filter this overload of mineral sand. Over time, those tiny crystals can irritate and inflame the delicate kidney tissue. This leads to a condition known as nephrocalcinosis. This is not the same as a large, painful kidney stone. This can be worse. This is a fine, diffuse calcification deep inside the working part of the organ, the part that actually does the filtering. This is the hidden risk. Once your calcium levels in the blood get too high, a condition called hypercalcemia, your kidneys are the first organs to take the hit. They are working hard, desperately trying to remove this excess calcium. But in doing so, they become strained. The calcium can settle in the tiny tubes, forming microscopic blockages, and over time, these blockages reduce your kidney's ability to filter waste. This is when the symptoms we talked about, the fatigue, the thirst, the urination, begin to appear. It's a sign the system is overloaded. The kidneys are remarkable, each one containing nearly 1 million tiny filtering units called nephrons. They rely on delicate pressure and clean membranes. When calcium builds up, it's like pouring concrete into that precision system. The filters stiffen, the small blood vessels narrow, and what started as a simple vitamin imbalance slowly becomes a mechanical problem deep within your kidneys. Section number 2, real world evidence and warning signs. Now, I want to be clear. What I am describing is not just a theory on a chalkboard. We are seeing this happen in real life. Over the past few years, doctors and clinics have started to see more and more patients, especially older adults, showing up with signs of kidney stress or even acute kidney failure after taking high doses of vitamin D3 for long periods. One case, published by Healthline, involved a man in his 60 seconds. He was proactive about his health. He believed he was doing everything right for his bones. He had been taking between 8,000 and 12,000 international units of vitamin D every single day for months. But one day, he began feeling unusually tired, nauseated, and he noticed he was urinating far more often than normal. When doctors ran his blood tests, they found dangerously high levels of calcium, and his kidney function was severely reduced. It took weeks of intensive medical care and hydration therapy just to stabilize him. And even then, his kidneys never fully returned to normal. He had permanent damage. This is not an isolated case. The Mayo Clinic has reported several examples of what is called vitamin D toxicity. It leads directly to hypercalcemia, that condition where calcium in the blood rises beyond what the body can regulate. When that happens, the calcium literally precipitates out of the bloodstream. It forms crystals inside the kidneys. Over time, these deposits harden, causing inflammation and permanent scarring. Some patients require hospitalization for severe dehydration and electrolyte imbalances. Most people never suspect the vitamins. That's the real danger. They think kidney problems only come from diabetes or high blood pressure. But when you look at the pattern, it becomes clear. Excessive vitamin D intake, especially without medical monitoring, quietly builds a calcium overload that the kidneys simply cannot handle. It doesn't happen overnight. It develops slowly, one capsule at a time, until the body's filtering system finally begins to break down. So, what are the early warning signs? They are often subtle and easy to dismiss. You might start urinating more frequently, especially at night. This is called nocturia. This is one of the first signs. It's your kidneys working overtime, trying to flush out the excess calcium, and they are pulling water out with it. You might feel thirsty all the time. A persistent, nagging thirst that water doesn't seem to quench. This is a direct result of the water loss from frequent urination. Your body is becoming dehydrated. You might experience nausea after meals or general loss of appetite. Some people report strange bone or muscle aches, not the usual arthritis, but a dull, deep ache that doesn't make sense, or an odd sense of weakness, even when your blood sugar and blood pressure look fine. These are not just signs of aging. These are early signals that calcium may be circulating too freely, or that your kidneys are struggling to clear it. When doctors like myself evaluate these cases, we rely on specific biomarkers, blood tests, to see what's happening beneath the surface. First, we check your creatinine and your blood urea nitrogen, often called BUN. These are two key markers that reveal how well your kidneys are filtering waste. If these levels are elevated, it's a red flag that your kidneys are under stress. Second, we check your calcium levels in the blood. We look at both total calcium and ionized calcium. If this number is higher than normal, it means your regulation system is off balance. Third, we might measure your parathyroid hormone, or PTH. This hormone is the body's main thermostat for calcium. Checking it helps us determine if the body is compensating correctly or if the problem is in the regulation system itself. And finally, we check your vitamin D levels. And this is important. We often check both 25-hydroxyvitamin D, the storage form, and 125-dihydroxyvitamin D, the active form. This tells us if the body is overactivating the vitamin, driving more and more calcium into circulation. Sometimes imaging tests can confirm the physical effects. An ultrasound or a CT scan can reveal tiny white spots in the kidney tissue, small accumulations of calcium that shouldn't be there. These are the early stages of nephrocalcinosis, and they often go unnoticed until the symptoms get much worse. By that time, the damage may already be progressing toward fibrosis, where healthy, functioning kidney tissue is replaced by stiff, non-functional scar tissue. Section number 3, who is most vulnerable? This brings us to a critical question. Why is this a particular problem for people over 60? Why am I directing this warning to seniors? The answer is that the margin for error that you have when you're younger, that margin just isn't there anymore. Several factors come together after age 60 that create a perfect storm for this kind of supplement-induced injury. The first and most important factor is age itself. As we get older, our kidney function naturally and slowly declines. It's a normal part of aging. After about age 40, our kidney's filtering capacity, what doctors call the GFR, or glomerular filtration rate, tends to decrease by about 1% every year. So by the time you are 65 or 70, your kidneys may already be working at a reduced capacity compared to when you were 30. This means their ability to excrete excess calcium and balance electrolytes is less efficient. Even a small imbalance, one that a younger body could handle, can have a much bigger impact. The second factor is pre-existing health conditions. People over 60 are more likely to be managing conditions like high blood pressure or type 2 diabetes. Both of these conditions, especially diabetes, place a significant long-term strain on the kidneys. They are already working hard. Adding a calcium overload from high-dose vitamin D, it's like asking a worker who is already tired and carrying a heavy load to suddenly do a double shift. Their system is already vulnerable, and this extra burden can be the thing that pushes them over the edge. The third factor, and this one is so common, is what I call supplement stacking. It's entirely accidental. You see, it's common for someone to take a daily multivitamin That multivitamin might already contain 1,000 or 2,000 IU of vitamin D. Then, worried about their bones, they add a separate D3 and K2 combo pill that might be another 5,000 IU. And then, perhaps they are also taking a calcium supplement, and many calcium pills also add vitamin D to help absorption, maybe another 800 IU. Without realizing it, that person is taking 7,000 or 8,000 IU of vitamin D every single day. The combined dose can easily and unknowingly exceed what the body can safely handle, especially when it's taken daily for months or even years. And finally, we have to talk about medications. This is a huge risk factor. Many seniors are on daily prescriptions, and some of these can have serious interactions. A very common one is thiazide diuretics. These are water pills, often prescribed for high blood pressure. But one of their side effects is that they reduce the amount of calcium your body excretes in the urine. They make you hold on to calcium. Now, imagine you're taking high-dose D3, which pulls more calcium into your blood, and you're also taking a pill that prevents your body from getting rid of that extra calcium. It's a dangerous combination that can cause calcium levels to skyrocket. Another common one is proton pump inhibitors, or PPIs, medications for acid reflux or heartburn, like Prilosec or Nexium. Studies have shown that long-term use of these drugs can impair your body's ability to absorb magnesium. Magnesium is a critical mineral. It acts like a natural brake to calcium's accelerator. It helps keep calcium in check. So if your magnesium is low from the PPI and your calcium is high from the D3, you have lost that crucial balance. When you put all these pieces together, the natural decline in kidney function, the strain from other diseases, the risk of supplement stacking, and the interactions from common medications, the picture becomes clear. It's not that vitamin D3 and K2 are bad, it's that they are powerful. And for an older adult, that power must be handled with precision and awareness. Section number 4, safe solutions and healthy habits. Now that we understand the problem, and it is a serious problem, let's talk about how to fix it. How do you use these important nutrients safely? Because the truth is, both D3 and K2 are important. They support strong bones, healthy arteries, and a balanced immune system. The key is not to stop taking them out of fear. The key is to use them with wisdom and precision. Let's start with vitamin D3. According to research from the Mayo Clinic and other leading institutions, the general upper limit for adults is about 4,000 international units, or IU, per day. For most people, that is more than enough to keep their vitamin D levels in the optimal range without raising calcium too high. The goal is not to get your levels as high as possible. This is a mistake I see all the time. More is not better. It's about being in the sweet spot. If your doctor has measured your 25-hydroxy-vitamin D level, that number should ideally stay between 30 and 50 nanograms per milliliter Ng divided by ml. Going above 70 or 80, it doesn't make you healthier. It just dramatically increases the risk that calcium will build up where it shouldn't. I've had patients whose levels climbed above 100 simply because they were stacking supplements. Their intentions were good, but their bodies were paying the price. When it comes to vitamin K2, most studies suggest that a dose between 90 and 120 micrograms, not milligrams, per day is sufficient for adults. The form called MK7 is longer lasting and generally easier to absorb. You do not need massive amounts to get the benefit. What matters most is consistency. If you are using a combo pill, look at the ratio. Many high-dose products on the market are terribly unbalanced. They'll give you 5,000 or 10,000 IU of D3, but only a trace of K2, like 100 micrograms. That's turning the faucet on full blast without making sure the drain is open. The calcium floods in, but has nowhere to go. There are also situations where it's better not to combine them or to take them at all without medical clearance. If you already have kidney disease, even mild, or if you have a history of high blood calcium, you should not use these supplements without your doctor's direct supervision. And If you take a blood thinner like warfarin or Coumadin, vitamin K can interfere with how that medication works. This is a critical safety issue. Monitoring your levels is the single smartest thing you can do. I tell my patients to check their vitamin D levels at least twice a year, ideally once in the late winter when it's lowest, and once in the late summer when it's highest. Ask your doctor for the 25-hydroxy vitamin D test. At the same time, ask for a basic metabolic panel. This will check your calcium, and it will also check your creatinine and BUN, your kidney function. If any of those numbers start to drift upward, that's your body's way of asking for an adjustment. And for those who prefer a gentler approach, there are excellent natural ways to maintain your levels. Sunlight remains the best source of vitamin D. Your body's brilliant. It will never create a toxic amount of vitamin D from the sun. About 15 to 20 minutes of midday sun on your arms and face a few times a week can do wonders. In the winter, you can lean on foods. Fatty fish like salmon, mackerel, and sardines are packed with D3. For vitamin K2, the best food sources are things like egg yolks, aged cheeses like Gouda or Brie, and a traditional Japanese food called natto, which is made from fermented soybeans. It has the highest concentration of K2 on the planet and stuff. Finally, do not forget hydration. This is so simple, but so powerful. Your kidneys depend on water. Water is what they use to flush excess minerals, like calcium, out of your body. As a rule of thumb, aim for 6 to 8 8-ounce glasses of water per day. And if you drink coffee or alcohol, which are diuretics, balance each serving with a full glass of water. This simple habit protects your kidneys more than most people realize. It's about giving your body the conditions to use these nutrients wisely. So, let's bring this all together. We've covered a lot. The combination of vitamin D3 and K2, it can be incredibly beneficial. But as we've seen, it can also become risky when used carelessly, especially for your kidneys. These two vitamins are powerful tools. And like any tool, they have to be handled with respect. Too much D3 pushes calcium into the bloodstream. And without enough K2 or without strong kidney function, that calcium may settle in the wrong places, hardening tissues that should be soft. We saw this in real medical cases. But the good news, the most important takeaway, is that this is completely preventable. It's preventable by following safe dosage guidelines, getting regular blood tests, and staying hydrated. I want to emphasize, this is not fear-based advice. It is not about avoiding vitamins or distrusting supplements. It is about awareness. It's about seeing your health as a partnership between you, your doctor, and the choices you make every day. I am not asking you to change everything right now. Just do one thing. Sometime today, just go to your cabinet, take a moment to review your supplements, read the labels, and see how much D3 you are actually taking from all sources. That one small act of awareness, that is how this change begins. And to help us build this community of awareness together, if you found this information helpful, if you feel empowered to take that next step, please comment with the words "ready for action" below. I read the comments, and I want to know if this message resonated with you. Please stay hydrated and always, always listen to what your body is telling you. Those subtle signs are your best guide. You are far more powerful in your own health journey than you may think. Stay safe, stay healthy, and please subscribe so we can continue to explore how to protect your body from the inside out.